Welcome to Medical Minutes here on Time Warner Cable DMG TV2. This edition we will be talking about a variety of therapies: physical therapy, occupational therapy, and speech therapy. With us right now at Mercy Medical Center in New Philadelphia is Dr. Laura Williams, and she is a doctor of physical therapy, right?
That's right.
What does that mean? What do you do?
I am a physical therapist. I work primarily with adult patients, although we have some other services here. And I treat, historically, we treat a lot of low back pain, but really any kind of joint pain, any kind of neurological issue. So the variety in physical therapy is just from one end to the other, from little tiny babies to great big old people. So we treat everything.
Now, as an adult, would you have to be injured, or say you broke your leg? Would you need?
Question. You know, a lot of people come here because they're injured or in pain, but we also see athletes who just want to be more efficient. So if you want less low back pain, let's say, that's a very common thing that we see. You may just want to work on being more efficient. That may mean just tweaking a couple exercises that you're already doing, or it may mean developing a whole new exercise program because you've never done anything before in the past. So it really can go from one end to the spectrum to the other.
And what about other things like stroke?
So we do absolutely treat neurological cases. In this case, we're talking about stroke, and we actually have a really nice group right now. We've got a support group that meets here monthly, and Lydia Dennison is running that. And if anybody would have any questions, it's a great little group that is meeting to give each other some support and just learn more about some of the options within therapy, but just overall more about stroke, so it can really help them. We also have another program for women's health, is what we call it, for women who have pelvic pain or any kind of gynecological issues that I might be able to help them with. So that's kind of a different program too.
And you need physical therapy for that.
Yeah, you do. So if women have pain, maybe after having a baby, or any kind of incontinence, I can help them with that. So it's really very much state of the art.
What do they have to do? What kind of exercises, machines? What do you do with
Well,
that?
we have tons of equipment here, but most of our therapists are very manually focused, which doesn't mean much to anybody else. But to us, it means that we do a lot of hands-on care for people.
Meaning that they need to do what?
They're going to do all kinds of exercises. So we have some equipment. They might do equipment. Some people will never touch a piece of equipment because that would be a silly thing for them to do. Other people might work on their balance, or they might work hand on hand with the therapist and doing exercises.
And so we see these humongous exercise
Balls and foam rolls and equipment, and we use all of that stuff. So, but some people should use balls, and some people should never touch a ball because they're going to fall off a ball. And some people might use equipment, and other people should never touch a piece of equipment because it's not best for them. So we do individualized exercise programs. So it really does vary. Depends what you need.
And how often do they need to come in?
We have some patients who will come in 3 times a week. That is kind of average. We have some people come 2 times a week, and some of my women's health patients might only come once a week. So it really, again, we look at the patient, we find out what they need. If we have somebody that, I had somebody in who exercises 5 times a week elsewhere, so they're only going to come in once a week just to kind of clean things up and get things right.
And what about success rates? Everybody healthy and back to normal?
Well, I wish I could say everybody was healthy and back to normal, but what I can tell you is that we use something called the health scale, and this idea of we want you to be healthier. And so for many people, that means they're able to do more with less pain. Awesome. But I can't fix that you broke your leg or you broke your back or something like that. I can't change that, but we can sure make people healthier. And a lot of people really feel better. And that's, of course, why we like our jobs, because it's fun. We get to see people get better.
And how much do they have to do at home?
I love people to get exercise 3 to 5 times a week at home, but I have some people who just can't do that. So we, again, try and find what their needs are.
All right. And then how do you get people to come in here? I mean, are they referred?
So the law is you can just walk through our door and be treated, but insurance companies don't really encourage that. For most of us, we need a referral from the doctor to say what the problem is, and that starts that process. If anybody just calls in and says, I have back pain, we will give them a 15-minute free screening, and they can come in and just talk to us, and we can kind of point them to the right person. But generally, we want you to see your primary care doctor, or if you're in pain management or arthritis center or wherever else you might be, want you to talk to that doctor and come down and talk to us and see what we can do to help you.
All right, any advice for adults to avoid physical therapy?
So stay active. Walk 10,000 steps a day. 10,000 steps translates into about 5 miles a day. And those little pedometers, those little fit pedometers that everybody's selling now, they're great. They're on sale at Christmas time. Walk 30 minutes a day. It's good for you, and it will lower your risk of injury. Walk. It's really good.
All right, fantastic. Dr. Laura Williams here at Mercy Medical Center in New Philadelphia. She is a doctor of physical therapy for adults here, and Medical Minutes will continue in just a minute.
Myers & Miller Podiatry provides complete foot and ankle care to patients of all ages. The practice was established in 2000 by Dr. Adam Myers and has grown to include Dr. Andy Miller in 2007 and most recently Dr. Jason Backage in 2010. Our core values of respect and honesty are the basis for how we manage our practice, and we have grown by building relationships with our patients in order to better serve their needs. Myers & Miller Podiatry serves Tuscarawas and Holmes County with offices in Dover, Sugar Creek, New Comerstown, and Millersburg. Let's get started building our relationship.
WJER and TV2 would like to introduce you to a new website, WJERTV2.com, where you can watch exciting high school football, soccer, and volleyball replays from TV2 Sports on your home computer, smartphone, or tablet. Also watch the latest episodes of TV2's original programming, Sports Talk, The Garden Girl, The Not So Shy Chef, Off the Record, and Medical Minutes, as well as catch up on local community news and search for local businesses. So make sure to check out the new WJERTV2.com community website where everything's local.
Welcome back to Medical Minutes here on DMG TV2. This special edition talks about a variety of therapies: physical therapy, speech therapy, and occupational therapy. Right now, we are talking with Sally Bonner. She is a pediatric physical therapist here at Mercy Medical Center in New Philadelphia. And Sally, what's special about pediatrics? That's children, right?
Oh, the kids are just great. I love working with them because they just take everything. As long as you make it fun, they're willing to do whatever you want them to. And they just require, it requires a lot of thought. It requires a lot of planning, but the outcomes are immense. You just feel like you're really making a difference.
Now, how old are the children that come in to see you?
The youngest I've ever treated was 2 weeks old. And then
2 weeks old needs physical therapy. How are you going to teach a 2-week-old?
You start with head control. And mainly what I do is work on strength, movement, mobility, and ability to get around in your environment. And so we start with the baby who can't hold up their head. Usually if I get them that young, they have a preset diagnosis such as Down syndrome, something that they know right from birth. Most of the time the physicians don't refer them till they're 3 or 4 months old. And the infants that I often work with is because they aren't lifting their head, they're not rolling over, they're not able to sit up, they're not reaching, they use one side of their body more than another. And so it's called a developmental delay. And those kids, we try to get them back on target. We try to get them to use both sides. We try to get them to move, to lift their head, to get stronger.
And how do you do that? I see all these great toys everywhere.
Well, with the babies, the first thing is to just get them used to laying on their tummy and lifting their head to look at toys. We use mirrors. We use a ball that they can lay on the ball, and I can roll them on the ball, and they can learn to lift their head. I use some movement of their neck if that's what they need. I do active movement. I do passive movement. Passive means it might be a little uncomfortable at times. But that's just for the infants. Now, we work clear up through, I have my oldest child right now is 30. Um,
30.
yes. Still considered a child because their problem occurred when they were a child. Typical diagnoses I would see would be cerebral palsy. I've seen kids with cancer, kids with spina bifida, if you're familiar with that, Down syndrome. But more recently, we see a lot of kids with clumsiness, kids with autism. So there's a wide spectrum of different kinds of problems. And I also treat kids with orthopedic injuries, such as sports injuries, if they're under a certain age.
And how often do they come see you? Is this an ongoing?
Yeah, generally I see them once a week. And I always say it's a team effort because most of my job is teaching the parent what to do with them and how to work with them at home to help them do better. So if it's an infant, I give the parent home programs to work on, and we come back a week later and we adjust that, depending on how the baby's doing with their strength. If it's an older child, they sometimes have a home exercise program. The other thing we do is we have a pool here. Some of the children I work with in the pool, it's a great strengthening tool. And also working on, we have a treadmill in our pool, so the older kids can run in the treadmill if they have orthopedic injuries. And I also use some of the adult equipment with the older kids. So
And how do you gauge success? When are they ready to move on?
we set goals. As they achieve the goals, we set more goals. For instance, the baby who needs to learn to roll over, once they do that, if they're still having issues and they're still behind, the next goal might be crawling forward. The next goal might be pulling to stand, and you work through the whole developmental sequence. The child who has orthopedic injuries is very different. We want to get them back to where they were before their injury. So sometimes they'll come 2 or 3 times a week, and usually for a shorter period of time. Most of the infants I keep until I know they're doing really well and I don't see any issues, or they're walking. So sometimes they come for a couple years, or more. The severely involved children that I work with, and we have a light gate, which is an overhead lift system that we use to help them learn to walk. The ones that are the most severely involved can come for a long, long time. The light gate that we have was purchased by Rainbow Connection locally here, and they gave it to us, and it helps children who couldn't stand and walk be held up in standing so we can teach them the walking patterns.
Wow, and I imagine that's pretty helpful.
Yes, I've actually had some great success with older kids who couldn't use a walker before go from the light gate to a regular walker and be able to walk with it. So that's, and it took a couple years. It's not fast. Changes with the kids, sometimes fast, sometimes slow.
And did you know you always wanted to do this?
From the time I was 11 years old, I always wanted to be a physical therapist. Pediatrics, I started probably about 25 years ago, just working with kids. So before that, I saw adults too. But love being a pediatric therapist, love physical therapy. It's a great field.
And having people come in and use all the equipment in here, you have to keep up to date then.
Oh, yes. Continuing education is a really high priority, especially working in a rural area like we are here. I do at least one major continuing education program a year. I have taken master's courses in reading, internet reading, just lots of different ways to keep up. I taught for a while at Sark State, so that was a really good way to learn more. And so just try to keep up on the newest things. It is a big issue, and it's hard to do because there's so many different areas.
Well, like the Rainbow Connection donating the liftgate, and the equipment must be updated too, right?
Absolutely. And you can do a lot with very little equipment, but it's nice to have options. There's certain kids that you can just get a lot more out of. And I love using the pool. I never had an opportunity to use it until about 4 years ago. And it's just opened up for a lot of kids. They'll work harder in the pool than they will on land. The 3 to 7 year olds and some of the older ones will work a little bit harder in the pool.
I imagine it must be difficult to motivate the really younger children.
Yeah, we try to make it fun. We kick the ball down the hall if we have to work on balance. We stand and look in the mirror and play with dolls and do all kinds of creative play. we, I've roller skated with kids down the hall. We have an adaptive bike. So,
We got to get that on camera.
well, there are a lot of different ways to do it, but you can do it with very little if you need to. It just depends on the child. I like to use the adult equipment with the 10, 11, and 12-year-olds. They think that's big stuff, They like to get on the treadmill and some of those things, and anything that works.
Great information. Sally Bonner, she is a pediatric physical therapist here at Mercy Medical Center in New Philadelphia. We'll be moving on to speech therapy next. Stay tuned.
Hi, I'm 1450 WJER's Bill Morgan, inviting you to join me on television Wednesday evenings at 7 and Friday afternoons at 5 for TV2 Sports Talk. Sports Talk is your weekly look inside high school football, volleyball, soccer, and more. Look for guest appearances from your favorite area coaches and players. TV2 Sports Talk, Wednesday evenings at 7 and Friday afternoons at 5 on DMG Channel 2 on Time Warner Cable.
I'm John Maselli, and I would like to welcome you to the Sunnyside Store restaurant. Since 1999, we have served over 500,000 meals. We specialize in steak, pasta, and the patron special, ribs. The Sunnyside Store is located at 5495 North Worcester Avenue in Peral. Hours are Monday through Friday, 11 a.m. to 10 p.m. Sunday, we open at 9 a.m. for breakfast. For more information or to schedule an event in the banquet room for groups of 40 or smaller, call 330-364-5474. This is John Maselli inviting you to the Sunnyside Store restaurant.
Welcome back to Medical Minutes here on DMG TV2. I'm Jennifer Clark, and this time around we are with Laura Goodall. She is a speech-language pathologist here at Mercy Medical Center in New Philadelphia. There's so many different therapies you can do, and speech is just one of them. What do you do? What's a speech pathologist?
Well, I treat children and adults ranging from 2 years old to 70, 80 years old. The children I treat speech and language deficits. Some of them can't talk. Some of them have medical diagnoses that they need extra help for to develop their speech and language. The adults I have are some stroke victims that may have some memory or attention deficits. And then I also have some traumatic brain injured patients that need to learn how to speak again, also have memory problems or attention deficits.
And when you say children that don't speak, are they autistic? They have other medical issues?
Some of them do, and some of them are just simply delayed. Some of the medical diagnoses I see are cleft lip and palate, autism, cerebral palsy, where they have some muscle weakness, and it's difficult for them to put their sounds together, different things like that.
How do you fix that? Let's start with children, because their attention is much different. So how do you fix that in a child?
Well, all therapists are different. I like to do a play-based therapy. I interact with the child, make sure they're comfortable, they learn to trust me, and then we just do some play-based therapy, simple things as putting things in a box, in and out, back and forth, go, ready, set, go. I have a patient right now that has autism that didn't speak when he came to me, and we started moving a car back and forth and saying, ready, set, go, and now he says, ready, set, go. So it can be as simple as that, but every individual is different. So therapy can go in many different directions.
What about teenagers? Are they different from younger children?
Yes, and most of the teenagers I see, if they have a medical diagnosis like autism, most of it is social therapy. And I have some teenagers that are still working on speech, certain sounds that they have difficulty making, like the R's.
And how do you fix that?
Well, it's all about where we put our tongue at in our mouth, and so we do a lot of drills. with the R sounds, some worksheets and things like that. So.
And you mentioned older adults, say a stroke victim. That's got to be extremely hard to help them get back to where they were.
It is, and there's a lot of counseling involved in that as well, because the adults, it's difficult for them to accept where they're at, and they can't do the things they used to do. So a lot of times we are doing counseling and getting their spirits back up and giving them hope that they can get better. As far as memory, a lot of it's memory loss. So they get a notebook and they have to keep track of what they do every day. And then I give them little tips on how to remember things.
And how often do they come in? Is it once a week, every day?
Well, typically I see them once a week for 30 minutes, sometimes 45. I like to see some patients I see we'll see 2 or 3 times a week. For the stroke patients, that's something I see them 2 to 3 times a week for a shorter period of time. A lot of the pediatric patients are ongoing. Sometimes I see them for years. As long as my schedule is allows, I will see them more than once a week if need be. A lot of them get it in school as well. It's a different environment, so they're getting different kind of therapy, but they're getting both.
And most of your patients are from around the Tuscarawas County area, so they don't have to go far.
Yes, we do have people that travel, though. We have patients that come from Newcomerstown, Coshocton. There's not a lot of options for speech therapy around here, and people still don't even know about us being here. So
Now they do.
yes, exactly, and we appreciate this so much. So
Well, I imagine that your schedule then is pretty full every day.
it is. I can see anywhere from 10 to 18 patients in a day. I work 3 10-hour days and then 2 6-hour days. So
And how do you gauge their progress?
about every 6 months we reevaluate. Unless they've made tremendous strides that are significant enough, then we'll reevaluate sooner. But we have a baseline testing that we do, and then we set goals, and then we just monitor how far they reach their goals.
And like you said, some patients will just continually come to you.
Yes, and it's very important too. We have some parents that are involved and go home and do the work that I give them to do at home and take care of their take-home program. Those kids tend to succeed quicker. Once a week for 30 minutes is never enough. It's an everyday occurrence. I mean, you need therapy every day when you're not speaking. And so I give parents things to do at home. Many of them follow through, some do not. So it depends on that too, and collaboration with the doctors and the teachers and the parents.
Well, good to know that you're right here in the area for speech therapy.
Yes.
Fantastic. We will continue with our therapy sessions here at Mercy Medical Center when Medical Minutes continues.
Myers and Miller Podiatry provides complete foot and ankle care to patients of all ages. The practice was established in 2000 by Dr. Adam Myers and has grown to include Dr. Andy Miller in 2007 and most recently Dr. Jason Backage in 2010. Our core values of respect and honesty are the basis for how we manage our practice, and we have grown by building relationships with our patients in order to better serve their needs. Myers and Miller Podiatry serves Tuscarawas and Holmes County with offices in Dover, Sugar Creek, Newcomerstown, and Millersburg. Let's get started building our relationship.
Searching for quality bottled water? Call Crystal Springs Water Company. Crystal Springs Water is a family-owned and operated company that's been proudly serving the community since 1986. Crystal Springs offers a quality bottled water in a variety of sizes to suit your everyday needs. They also carry a selection of water coolers, cups, bottle racks, hydro pumps, and premium water softening salts. All available for pickup or delivery. Call Crystal Springs Water Company today.
Welcome back to Medical Minutes here on Time Warner Cable DMG TV2. This edition we're talking about a variety of therapies, physical therapy, speech therapy, and now we're going to talk about occupational therapy. This is Christy Bowers. She is an occupational therapist at Mercy Medical Center here in New Philadelphia. Tell me, what's an occupational therapist? What do you do?
It's complicated.
It sounds like work.
Yeah.
Occupation, job.
Yeah. Well, it's not a job. They consider occupation to be life skills, life things. So an occupational therapist in an adult setting would help someone who's had a stroke learn how to dress again or make their coffee again, that kind of thing. With kids, we work on everyday skills, play, writing, fine motor skills, it's just social skills. So it's a very varied field. It just depends on the setting that you work in.
It sounds so broad.
Very broad. You'll see occupational therapists in schools, settings like this, outpatient, inpatient hospitals, psychiatric facilities, nursing homes, community mental health centers. You'll see OTs just about everywhere.
And how do you decide what they need to learn? We'll start with adults. Say a stroke patient needs to pour a cup of coffee and they just can't. How do you decide what to work on?
Well, our philosophy is to look at the whole person. So it would depend on if they've had a stroke, how physically involved they are. Sometimes it's a matter of teaching them a new way to do it. Sometimes it's a matter of working on, say, the hand that was affected by the stroke to teach it how to do it again. So it just depends. You have to look at the big picture.
And do you also work with the other therapists, the physical therapists and the speech therapists?
Oh, yeah. We definitely have to work together to kind of build the whole picture of the person.
And what's the most difficult part?
I don't know. I really like my job, so it's really easy. Yeah.
It's easy to retrain people to button their shirt.
Not easy. You have to have a lot of patience and be willing to work through the emotions that are involved in something like that.
That's my next question would be just that. How do you gauge, the psychology part of it?
It's a lot easier said than done. I think you just have to have experience in dealing with people and be willing to let them vent. Because a lot of times they just need somebody to listen. And once you do that, then they can take a breath and go on to the next step.
I imagine they get very frustrated.
Easily, yes. Lots of tears at times.
And so what do you do?
Just listen and let them get it out so that we can move on.
And then things that you're working on, do they do it at home as well? Do they only do it when they come see you?
Ideally, they're practicing at home.
Ideally.
Doesn't always work that way, but ideally.
And compare adults and children. Adults, do they work harder at it? Are they more focused? How are adults and children different when you're dealing with occupational therapy?
Kids are a lot easier because they like to play, and if you frame it in that framework of, well, we're playing, it typically goes a lot smoother. Adults think too much. They overthink things instead of just practicing and doing like we ask sometimes.
So you use toys with kids, but adults, they probably don't want the toy car, right?
Exactly. Kids are easier to bribe.
And how often do they come in to see you?
Kids typically once a week. Adults anywhere from 1 to 3 times a week.
Is that enough?
Hopefully. Not always. We're stuck with, the changes in healthcare, so you have to work with what the insurance will let us do.
And then how long does it take for them to not be your patient anymore?
The adults, usually typically within a couple months. Kids, some of my kids I've been seeing for years.
Are they continual? Will they ever stop seeing you?
Hopefully. That's the goal. That's the end game. But some of the kids, we see them until they graduate high school. It's just kind of the way it goes.
Now, how long have you been doing this?
20 years.
So I'm sure that you have a couple of patients that are your star patients that you will always remember, right?
Oh, yeah. Yeah. They're all stars. I like them all.
Oh, very politically correct.
No, I really do.
Yeah, it must be fun to watch them succeed.
Yes, that's the best part of it, is to watch them figure it out. And they're like, oh, I can do this. And then that's the fun part for me.
And the little light bulb goes off.
Yes, exactly.
All right, very good. Christy Bowers, she is an occupational therapist here at Mercy Medical Center in New Philadelphia. Thank you for joining us here on Medical Minutes.